Hello, my name is Dr. Alan Detton, and in this lecture I will be going over the special areas of the lower limb. At the end of this lecture, you will be able to identify the boundaries of the femoral triangle, the adductor canal, and the popliteal fossa. Additionally, you will be able to identify the major contents of the femoral triangle, the adductor canal, and the popliteal fossa. Near the ankle, you will be able to identify the structures passing along the medial aspect of this region through the mnemonic known as Tom, Dick, and Harry. Lastly, you should be able to identify the surface anatomy landmarks on the anterior and posterior aspects of the lower limb. The femoral triangle is a region in the anterior thigh of a triangular zone that will help you identify many of the structures within this part of our body. And to help you remember the sequence of the structures within the femoral triangle, I like to use the simple mnemonic navel, which will help you remember the order from lateral moving medially, that the femoral nerve is the most lateral structure within the space, followed by the femoral artery, the femoral vein, and then lymphatics. So let's first take a closer look at the boundaries of this area before we look at those contents in more detail. The first thing that we're going to see is that the lateral boundary is formed by the sartorius muscle. Recall that the sartorius muscle began at the anterior superior iliac spine, the ASIS, and then coursed medially and diagonally down through our thigh. The medial boundary of the femoral triangle is going to be one of the adductor muscles, the adductor longus muscle. So we can now see the lateral boundary formed by the sartorius and the medial boundary formed by the adductor longus muscle. The base of the triangle is actually going to be the inguinal ligament. So the base is going to be directed superiorly and the apex is directed infromedially. So now we can see the inguinal ligament, adductor longus, and sartorius forming the boundaries of this space. Deep to the contents, the floor of this area is going to be made by the iliopsoas muscle laterally and the pectineus muscle medially. Recall that the iliopsoas was formed by the psoas major and iliacus as they join inferior to the inguinal ligament. So the iliopsoas will be deep to the contents laterally, while the pectineus muscle will be deep to the contents medially. The contents within the femoral triangle are best remembered, again, with that mnemonic navel. So beginning laterally, we can see the femoral nerve, then the femoral artery, and lastly, the femoral vein. The femoral nerve is typically located between the junction point of psoas major and iliacus, as the femoral nerve needed to pass deep to the psoas to get more superficially to reach the contents in the thigh. So the femoral nerve will be most lateral, the femoral artery is near the midline of the inguinal ligament, and the femoral vein is located just medial to it. One way you can help differentiate between the artery and the vein in the cadaver is to look for the presence of the great saphenous vein draining into the femoral vein more medially. Now the last content of this space is an empty space where we call the femoral canal, a small area that is going to have fat and lymphatics. The deep inguinal lymph nodes are going to be the most medial area of, or the most medial content within this area of the femoral triangle. So navel is going to stand for the femoral nerve, femoral artery, femoral vein, and then lymph nodes, which are predominantly the deep inguinal lymph nodes. So the lymph from our lower limb is going to enter the abdominal cavity by passing medial to the femoral vein within this space. The adductor canal is a special region within the thigh that is going to allow for the passage of the femoral artery and femoral vein infromedially down through the thigh, to then emerge posteriorly behind the knee within the popliteal fossa, as these vessels become the popliteal artery and the popliteal vein. To better visualize the canal, I've cut a window through two of the muscles within the anterior compartment of the thigh, the first of which is the sartorius muscle. The sartorius muscle is the long muscle that is going to help us flex both our hip and our knee, and this muscle courses infromedially, basically cutting diagonally and medially across our anterior thigh. This muscle is going to form the roof of the adductor canal, meaning that the structures that are going to pass within this space will lie deep to the sartorius muscle. Therefore, I needed to cut a window through this muscle to allow us to see the path of those vessels. I've also cut through the vastus medialis, one of the large quadriceps muscles, that is going to be on the medial aspect of our knee. The adductor canal is going to begin at the apex of the femoral triangle. So recall that the femoral triangle was going to be the space on our anterior thigh bounded laterally by the sartorius muscle, medially by the adductor longus, and at its base by the inguinal ligament. So as the femoral artery and femoral vein pass inferiorly, and they're going to begin the path in the adductor canal at the apex of the triangle. So beginning at the apex, passing inferior and deep to the sartorius muscle, these vessels are going to continue until they pass through an opening within the adductor magnus, known as the adductor hiatus. So here we can see that the adductor magnus, a large adductor of our thigh, is going to have two different components. There's going to be the adductor portion, more superiorly and medially, and a hamstring portion that will attach more distally. These two attachments are going to create an arch, or essentially create a window that these vessels can pass through. So the adductor hiatus is going to be the boundary point for where the femoral artery and femoral vein are now going to change names. So anterior and superior to this point, they are femoral, and then as they pass through this opening of the adductor hiatus, they're now going to change names and lie posteriorly within the popliteal fossa and be referred to as the popliteal artery and popliteal vein. So the adductor canal is going to terminate at the hiatus, begin at the apex of the femoral triangle, and lie deep to the sartorius muscle. The popliteal fossa is a diamond-shaped depression on the posterior aspect of our knee. Within this area, there is a lot of fat that is going to surround and protect the contents within this space. The reason that this is a really good area to understand is that by understanding the boundaries and the contents, you can better identify many of the structures within this region of the lower limb. Let's begin by taking a closer look at the boundaries that form the popliteal fossa, beginning with the supromedial boundary, which is formed by the semimembranosus muscle. Recall that two of the hamstring muscles, the semimembranosus and the semitendinosus, both passed along the medial aspect of our knee. The semimembranosus is a large muscle inferiorly, and it's going to help reinforce the posterior aspect of our knee joint capsule, and it's going to form the medial boundary superiorly of the popliteal fossa. The supralateral boundary is going to be formed by the biceps femoris muscle. Recall that the biceps femoris had both a long head and a short head, both of which will pass across the knee joint along the lateral aspect of the knee. So the hamstring muscles, the semitendinosus, semimembranosus, and the biceps femoris long head are going to help form the supromedial and supralateral boundaries of this fossa. On the inferior aspect, we're going to have one muscle form both the medial and lateral boundaries. the gastrocnemius muscle. The medial head of the gastrocnemius forms the infromedial border of the popliteal fossa, while the gastrocnemius lateral head forms the lateral boundary. Within the popliteal fossa, we're also going to have a deep boundary, or the floor, made up by the surface of the femur along its posterior distal end. The roof would be the overlying skin and popliteal fascia of the region. Within the popliteal fossa, there are three dominant contents that are stacked up along the midline of the knee. Beginning with the most deep structure, this is the popliteal artery. So an easy way to remember this is the most important structure coming down into the lower limb, especially the leg, is going to be the artery as it carries blood to this region. Sitting superficial to the popliteal artery, we can identify the popliteal vein, which is more readily identifiable due to the presence of the small saphenous vein draining into the popliteal vein. So the artery will be the deepest of the structures within the popliteal fossa. Then as we come more superficially, the next structure we encounter is the popliteal vein. The most superficial of the contents are the nerves, the tibial nerve and the common fibular nerve. Recall that these are the two division points of the sciatic nerve. So the tibial nerve is going to be the more medial of the two branches from the sciatic nerve, and it's going to overlie the popliteal artery and vein as they enter into the leg along the midline. The common fibular nerve is going to be the more lateral division from the sciatic nerve and course laterally in close proximity to the biceps femoris muscle. To remember the order of the structures passing between the medial malleolus and the calcaneal tendon, beginning anteriorly and moving posteriorly, remember the saying, Tom, Dick, and a very nervous Harry, often simply referred to as Tom, Dick, and Harry. This is going to help you remember the names of the different structures passing within this region. So again, let's begin with identification of the medial malleolus and the calcaneal tendon. The first tendon that you can palpate crossing posterior to the medial malleolus is the tibialis posterior tendon, which is going to start our saying. So T for tibialis posterior is Tom in the mnemonic. D in the mnemonic is for flexor digitorum longus. So the next tendon that we're going to see passing behind the medial malleolus is the flexor digitorum longus tendon. The last muscle tendon that we see passing through this space is going to be for Harry. Now Harry is going to be the flexor hallucis longus muscle. And the flexor hallucis longus muscle is going to be the deepest of these three tendons. So often we refer to Harry as being very nervous because he tends to hide. It's a large, big muscle in the posterior leg, but here we just see the deep tendon emerging behind or deep to the calcaneal tendon. So the order of the tendons is TDH for Tom, Dick, and Harry, with tibialis posterior, flexor digitorum longus, and flexor hallucis longus. The other structures that are passing through this space can be remembered by the simple addition of a very nervous Harry. And this will help us remember the artery, vein, and nerve passing within this same space. The artery is the posterior tibial artery. And the posterior tibial artery will be sandwiched by the two deep paralleling posterior tibial veins. So the artery and the veins are going to be located more anterior or closer to the medial malleolus than the tibial nerve. The tibial nerve is going to run by itself and then split into the medial and lateral plantar nerves. So remember that the arteries and the veins are going to have posterior tibial in their name, whereas the nerve is simply the tibial nerve. So Tom, Dick, and a very nervous Harry are going to be all of the structures, again passing between the medial malleolus and the calcaneal tendon on the medial aspect of our foot.